about a gourmet cooking. It pairs the art of food preparation and the science of medicine. It is the practice of helping patients use nutrition and good cooking habits to restore and maintain health. It's about teaching the why and the how behind low-cost, convenient, health-promoting, and delicious home-cooked meals and healthy eating patterns. The objective is to educate about the powerful influence that food has on health and disease. The goal is to establish skills in preparing meals with nutritional benefits and develop the habit of being a smart consumer, someone who would always consider what follows after every swallows. As we speak, more and more medical practitioners and lifestyle medicine service providers are seeking the certification in culinary medicine. And now, the Philippine College of Lifestyle Medicine finally brings culinary medicine certification course in Asia. It is a program with a blended curriculum composing of online and in-person modules that anyone can finish between 6 to 12 months at their own pace. There will also be a remarkable emphasis on chronic disease prevention and reversal, such as diabetes, heart disease, dyslipidemia, basing on published evidences. Bottom line is, culinary medicine is a course that should be taken by anyone who has the risk or who already have the chronic disease, where the cost is mostly within the control of our lips. See the link, register, and get your kitchen ready.
It's not an ordinary cooking class, it's culinary medicine. This is all about practical nutrition education, cooking skills, and healthy behaviors, both for patients and for the students themselves. Culinary medicine is an evidence-based practice of blending cooking and the science of medicine. We're not only just looking to support the health of patients, but equally much the support of the wellness of our healthcare providers. We're talking about what we eat, how we prepare it, what do we put in it, why do we have such food preferences, and how do we deal with those unhealthy cravings, and develop our taste buds to enjoy healthy foods instead. We help people to learn the direct link of food consumption and health based on the evidence out there showing the impact of nutrition on overall health outcomes. We see this practice as totally groundbreaking. Many healthcare providers have no idea how to work that science of nutrition and actually use it in a way that translates healthy eating behaviors to their patients. And it's also least likely that physicians would recommend an optimal diet when they are not practicing it themselves. Studies show that healthcare providers who are eating healthy themselves would talk to their patients about diet and nutrition because they are a better example for them. Our students learn the nutritional science. We also teach them practical skills on food preparation using fresh produce and plant-based ingredients, and we work on increasing their level of confidence. When these three are combined, we can make sure that culinary medicine can be translated in their home kitchen. And this can benefit not only the students enrolled in our course but their family as well. Once people understand the science behind diet-related diseases, and realize how easy it is to prepare healthy meals from scratch, they would most likely stick to the new lifestyle, and eventually develop sustainability and improve health outcomes. In culinary medicine, we give a huge emphasis on behavior change. This can be particularly challenging for both the patients and the healthcare providers because we know very well that it's hard to make changes in our own lives. It is a progressive journey that needs empathy and support. Our objective is to enhance nutritional literacy to both the healthcare providers, food industry professionals, and patients through engaging innovative online learning opportunities. Welcome to Culinary MD, and we hope you'll enjoy your lifestyle change journey.
Good day, everyone. I'd like to thank you for joining me this afternoon. I'm sure that you're looking forward to having the book on your hand already, and I'm sure that you're excited to browse what's inside. And it's about a year already since we started pre-selling the book, and I'm so happy that you are supportive of the Culinary Medicine Handbook. This afternoon, I would like to thank you for your support, and for those of you who have been joining our free webinars since last year during the height of the pandemic. Thank you so much for your support, and thank you for sharing the webinars that we've been providing. And I really hope that you have been learning something from those information and education session. I'd like to acknowledge those who pre-ordered the book from many different parts of the Philippines and other parts of the world as well. So we have orders from Singapore, from Hong Kong, from Indonesia, Malaysia, and of course, we also have from the Pacific and also Australia, and of course from Luzon, Visayas, and Mindanao. So we have orders. We got orders from private sectors and from the government sectors as well. I also wanted to mention that I'm dedicating this book to my family, to my friends, and of course to my patients. I also wanted to share with you that my inspiration in doing this is because of the health challenges that my family have. We are so rich with genetic predispositions for chronic diseases. It's totally complete. So we have Alzheimer's disease in the family, we have coronary artery disease, we have cancer, we have chronic kidney disease, we have hypertension, we have diabetes, name it. It's in our family background. This book is the first reference for culinary medicine in Asia, and this is for anyone aiming to prevent, arrest, and even reverse some lifestyle-related diseases that are afflicting over 70% of the world's population, including healthcare providers. We're not exempted here. That's why this book is made both for healthcare providers and for patients as well. If you've been attending our webinars, I would always say, and I would always describe and define culinary medicine as the new evidence-based practice that blends the art of cooking and the science of medicine. In fact, it was defined by the American College of Lifestyle Medicine as the practice of helping patients use nutrition and good cooking habits to restore and maintain health. Culinary medicine offers a simple approach by combining important scientific principles related to three basic factors, including nutrition, behavior, and culinary skills. And all of these are blended in the practice of medicine. The goal here is basically to understand how food preferences and the cooking habits of people, relate to overall health outcomes and personal healthcare goals. The field of culinary medicine was born out of a perceived need to improve nutrition literacy among healthcare providers and patients that is practical, economical, and accessible for everyone. It was reported that nearly 80% of the chronic diseases in the United States and other countries that adopted Western practices are preventable through lifestyle changes. It's the poor dietary intake that was identified as the top contributor to premature death and lost healthy life years. And the dietary risks are associated with 11 million annual deaths globally. However, only 25% of medical schools in the United States have an established nutrition course, and most of the content is primarily focused on nutritional biochemistry and micronutrient deficiency states. Very little time is actually dedicated to equipping students to learn the components of a healthy diet, to effectively counsel patients on improving their food choices. And unfortunately, this learned fragment of nutrition education remains only in the preclinical years in medical education and typically ends up disconnected from patient care. But through the dedicated efforts of lifestyle medicine experts today, culinary medicine is incorporated as the applied laboratory requisite of a nutrition curriculum for both undergraduate and postgraduate medical trainees. It is also integrated as part of the training programs for allied health professionals and incorporated as continuing education program for various fields of expertise. And this includes medicine, nutrition, nursing, hospitality, and culinary arts. Culinary medicine addresses optimal food choices, preparation, and acquisition while taking into consideration the cultural food preferences, the traditional practices, financial resources, and of course, time. The objective here is to ensure that this knowledge taught in culinary medicine is effectively translated into the patient's home kitchen, aiming to initiate and maintain healthy dietary changes. In fact, the hands-on and interactive approach to nutrition education utilized in culinary medicine allows learners to engage regardless of their training background. Although preclinical students may not appreciate the relevance of dietary counseling skills as fully as those at advanced stages of training, the interest in personal health or the health condition of a loved one can be an effective source of motivation for internalizing culinary medicine principles. But regardless of the background in training or practice, skills learned in culinary medicine can assist health professionals and patients in improving their own and their family's diet and positively impact health outcomes. This experiential learning in culinary medicine is beneficial not only for practitioners, but for the general population at large. In fact, studies show that providers are more likely to counsel patients on certain health behaviors that they engaged in. Of course, it would be relatively difficult to discuss improving a behavior without personal experience to relate with. Now, given that most health professionals and public health educators will interact with thousands of people over the span of their practice, dedicating time to integrate culinary medicine principles can potentially have an impact not only at the individual level, but also on population health. Finally, I'd like to emphasize here that culinary medicine principles are relevant to all specialties of medicine, allied health professions, the culinary industry, public health, and of course, to all educators. Patients and family members should also be exposed to culinary medicine and nutrition principles, which is particularly important because behavior change is much easier to pursue when there is a support from a whole family. Although most parents would educate family members on the importance of healthy eating practices, studies show that only 1 in 10 children and adults are consuming the daily recommended serving of vegetables. And it was also identified that a major key barrier to choosing healthy foods is the wide availability of tasty, cheap, fast, and unhealthy foods. Now, another key goal in culinary medicine is to emphasize that healthy food can be also tasty, fast, and inexpensive if only people know how to prepare and make a simple but delicious and craveable meal plan. There might be no guarantee that lifestyle medicine education will be sufficiently provided in undergraduate and graduate medical education, but the global lifestyle medicine movement is currently advancing the provision of nutrition education for healthcare providers through culinary medicine training. The book is made with 2 parts. The first part is composed of culinary medicine principles, and the second part is composed of over 100 plant-based recipes that you can try at home and that you can also teach your children to prepare and also share with your patients. It was published through Amazon Kindle Direct Publishing, and the book will be sent to you a few days after this launching. I'm also inviting you to watch out for the next upcoming series of webinars that Culinary MD will bring to you. I also wanted to take this opportunity to invite you to check out the website of culinarymd.org. If you're interested to look at the courses that we are offering, we have free courses, basic courses, and professional courses. You can always email us or send inquiry to our team, and they will be very willing to assist you. Please also check the website and the Facebook page of the Philippine College of Lifestyle Medicine if you want to learn more about lifestyle-related diseases, how to prevent, manage them using lifestyle medicine. Again, thank you so much for joining me this afternoon, and thank you so much for your support to the Culinary Medicine Handbook. Good afternoon, everyone.